Okay, so why don't we get this started? Good afternoon, everyone. Thank you for joining us this afternoon. My name is Lisa Lee. I'm the Dean for Student Services and Enrollment Management at the New York College of Podiatric Medicine. Today we have with us Dr. Janine Perez, Ronald, and Dr. Chusit, who's our Dean of our Preclinical Sciences, will be joining us shortly as well. So why don't we start with the next slide? We'll have Dr. Chusit introduce herself when she joins us. So first up, we have Dr. Janine Perez. She's a proud alumnus of NYCPM and is currently running her own practice here in New York City. So Dr. Perez, would you like to say hello?
Hi, everyone. Thank you for joining us. My name is Janine Perez. I did graduate the NYCPM class of 2011. How I got into podiatry, I don't know if you guys know much about the profession. I didn't. I was an athlete. I had bunions. They really hurt. I got referred to a podiatrist, and I actually ended up having surgery on both my feet, which was my introduction into podiatry. I researched the profession. I loved it. I started the school and graduated in 2011. I've been out of practicing now for almost 10 years. I was at a multi-specialty group. In the past year, I opened up my own practice. So I'm currently in Midtown Manhattan at Flex Foot and Ankle PLLC.
Thank you, Dr. Perez. Student Dr. Ronald, would you like to say hello?
Hello, my name's Ronald. I'm a rising third-year student at NYCPM. I got into podiatry because I have flat feet and both my parents have flat feet and they both have bunions. And so we've been to plenty of podiatrists and just a great experience overall. And I didn't know for the longest time that it was a separate school. I just assumed it was a different branch of an MD or DO. And then I got an Instagram ad for NYCPM and I found out more than I shadowed. So here I am. And so far 2 years in, I love the education.
And you're doing a great job as a student. Why don't we go to, yes. And so as Dr. Perez is going to be presenting on what podiatric medicine is, but I'd just like to make note that if you have any questions, feel free to send us your questions via the question and answer or via the chat. So Dr. Perez, will you kick this off for us?
Sure. Okay, so like I mentioned, I discovered podiatry because I had bunions, but part of the profession, basically we are the physicians of the foot and ankle, right? So you can go to an orthopedic or you can go to your internal medicine or your primary and they can help you, but when it comes to foot and ankle, we are it. And the subspecialties with podiatric medicine, as you can see the slide, there's surgery. I'm a surgeon. I was considering going into surgery, but once the surgery was done on me, I decided to focus on foot and ankle since, again, I have an athletic background. So we can do reconstruction and trauma, mainly usually reconstruction reconstruction is for people who, if they have a flat foot, like it was mentioned before, and all conservative treatment didn't really work out, then you start thinking more of surgery. Trauma is something that I did my fellowship on. I did a fellowship in Louisville, Kentucky, at the University of Louisville in trauma and reconstruction. So ankle fractures, any type of foot fractures, you put frames, it's a lot of surgery. It's call, meaning they can call you at any time at night and then you have to go, fix. But that's one aspect of podiatric medicine. Another one is sports medicine, which I'm also very much involved. Ankle scopes, lateral ligament reconstruction. Anytime, if you're an athlete, you sprain your ankle, you break a toe or so any type of ligament or tendon pain, we would be the ones that the athlete goes to. Another aspect of podiatric medicine that is very much growing is diabetic foot care, wound care, and limb salvage. As we know, our diabetics can get ulcers and then they get infections, and unfortunately, they undergo surgery mainly for amputation. So we try to prevent that, right? So all diabetics should have at least every year a checkup of their feet to make sure that they're doing okay. Unfortunately, with diabetes, you get neuropathy, so they don't have any sensation in their feet, so they can start developing problems, and they're not aware of it. How often, when you go to your doctor, do they take your shoes and socks off? Let me see what's going on down there. Doesn't happen very often. So with diabetics, it's very important that they do get their feet checked regularly. Orthopedics, when it comes to type of deformities, especially with kids, podiatrics, again, the flat feet, you could put in orthotics. Kids can be in towing, out towing, they can have equinus, meaning toe walking. So these are all things that, unfortunately, some physicians, it'll go away, they'll grow out of it. They might, but there's a grand majority that doesn't. And then they come to you for help, right? Biomechanics, same thing, the way that your foot interacts with the ground, mainly the way that you walk. There's a lot of forces that are involved, and that can affect the gait, your gait cycle, right? So if you have a flat foot, your foot's not really functioning properly and can travel up the chain. It can give you knee problems, hip problems, back problems. Going on down the list, there's geriatrics. So unfortunately, as we all get older, we start losing our balance. We're not as stable, and that's where a good shoe or some good foot support, again, orthotics or bracing, can help. Vascular, again, diabetics, in smokers, the blood supply getting to the foot is not that great. So we all know smoking can constrict your arteries, so it's hard for the blood to get to the area, especially your feet, right? Because they have small vessels, and the blood doesn't really get there. So if there's no blood, then that's when you start losing sensation as well. It's tied up with neuropathy, then you start getting ulcers. Neurological, same thing, problems that you can't feel. If you can't feel, you don't know what you're stepping on. It's important to always wear shoes if you have these type of problems. Dermatology, there's a lot of cancers, melanoma that starts in the foot. And again, if you don't get checked properly, you can miss these. There's also different types of cysts or infections that can happen in the skin, rashes. And if it's in the foot, usually you will go to a podiatrist. Plastics, when it comes to trauma and you need a flap, right? So if you suffered a bad car accident or even a fall down and part of the skin gets degloved, right? So you need something to put it on top, and that's where our plastics training comes in. We can do flaps in the lower extremity. And really with podiatry, you can do most of any type of medicine when it comes to the foot and the ankle, right? Because again, we can treat skin, we can treat arteries and veins, we do biomechanics, the way that your feet interact with the ground. It's a very, very comprehensive type of medicine that goes to the foot and the ankle. And personally, I find it very satisfying that I can help somebody, kids or adults, if you decide to treat kids, that come in and I can help them with kids. An ingrown toenail, I just had a patient actually, I just finished, really, really bad ingrown toenail. You get rid of it, you remove it, and kid's fine, mom's happy, they left. But you guys have any questions I can answer, but that's basically podiatric medicine in a little gist.
Next slide.
So again, why I chose it, because I got exposed into the surgery aspect of it, but you don't have to do surgery. That's the beauty about podiatry, right? If you want to be a surgeon, go ahead. If you want to stay more in the medicine part of it, as I mentioned, there are many types of subspecialties that you could deal with. But I'm a surgeon and that's what I wanted to do. So it is a fast track, right? You do 4 years of school in podiatric medicine, and then you do a 3-year residency. After your 3-year residency, you can start working. I decided to do a fellowship because I wanted to do reconstruction and trauma. So I did my fellowship in Kentucky. So you can do an extra year. Work and life balance. Well, I just started my private practice, so it might not apply so greatly, but I'm trying to build a business, right? So, but I'm a wife. I have a 5-year-old son. When I was working at the multi-specialty group, it was great because everything was taken care of for me. I can decide my own hours, and I still can in private practice, but I try to be as available as possible. So it's a little tough for me now, but it's been working fine. Earning potential. You set your number, right? That's part of you negotiating. Now that I'm in private office, I'm mainly out of network. I don't know if that means anything to you in regards to insurance, but basically I get to set my own price. When you work for a multi-specialty group, usually your salary and your payments or your compensation is based on RVUs. That's a whole nother topic. But on top of that, you can also get bonuses at every quarter. I used to, or at the end of the year. Job growth. everybody's got 2 feet and they are eventually going to have some problems. So the profession itself is growing significantly. I'm actually a board member for the New York State Podiatric Medical Association. I'm very much involved in podiatry in the state of New York. So I can tell you that we're advancing the profession forward. A variety of practice settings, again, basically what you want to tailor to, right? You can be a surgeon, you can be more medicine, you could be more sports med. And as I mentioned in the previous slide, there's a huge number of subspecialties within podiatric medicine that you can entertain. So where do we work, right? So as I mentioned, I actually was in a private multi-specialty group, Crystal Run, about an hour north. I was there for almost 9 years until I decided to open up my own private practice. You can do HMOs, you can do PPOs, hospitals. They very much do enjoy the podiatric field because, again, the diabetics, unfortunately, the number just keeps increasing, right? So if you're part of a hospital system, it's really easy access. Anybody walks through the ER, they page you, or if you work with residents, they page the residents, they take that over. But again, you're there with every other specialty. It's like, oh, there's not enough, blood supply getting to this foot. So you consult vascular, internal medicine to take care of the diabetics. When it comes to trauma, it's either you and you can work with your ortho colleagues and you can, together fix whatever problem there may be. Government and the VAs as well. You could be part of a medical school, even a sports industry, which I'm trying to get into. So we'd love to be the NYCPM, right? But we'll see. So there's the opportunities really are significant for a podiatric physician. And how do you become a podiatrist? So I can't see you guys, but I went to Manhattan College, so it was 4 years of undergraduate school. And then after that, you do 4 years of podiatric medical school. There are 3 boards that you do have to pass, Part 1, Part 2, and Part 3. After that, you do a residency, which is a 3-year podiatric medicine and surgery, rear foot reconstruction, and ankle. And then you graduate with this degree, and then you need to pass your boards, right? So once you pass your boards, then you can practice without passing the boards, but eventually you want to be board certified. There are 2 branches. There's the medicine board and the surgical board, ABPM and ABFAS. Personally, I'm dual board certified. Some are just one or the other. And as I mentioned before, I decided to do a year fellowship. I knew I wanted to do trauma in New York and reconstruction. So in order to be able to, I don't want to say compete, but bring myself up to the level of the orthopedics, I decided to do a year fellowship. Now, these fellowships could be in, like what I did, reconstruction and trauma. They can also be on wound care, plastics, limb deformity, and as well as pediatrics.
Okay, thank you, Dr. Perez. Dr. Chusa, thank you for joining us tonight. I'm glad you were able to make it.
Yeah, I'm on wonderful. We have a wonderful, wonderful school, but not so wonderful sometimes IT with our personal computers. So my phone.
Okay. Well, thank you for joining us. So Dr. Chusid is our Dean for Preclinical Education at NYCPM. So what she's going to be doing is giving us an overview of the curriculum, years 1, 2, 3, and 4. So Dr. Chusid, do you want to take over?
Yeah, so first of all, thank you everyone for joining us and your interest. I want to stress that how well-trained our podiatric physicians are, that the first 2.5 years of your podiatric medical school curriculum is identical pretty much to allopathic, in that biochemistry is biochemistry and general anatomy is general anatomy. So why don't we start with term 1? We've recently changed and updated our course in bacteriology. It is now medical microbiology. And that is taught by a bacteriologist and a virologist. And that course is very, very important because it's a prerequisite to your second-year course, a very intensive course in infectious diseases. And so that the podiatric physician is really, as you enter your 4th year and your 1st year PGY1 of residency, you are pretty much on par with your allopathic colleagues when it comes to infectious diseases, maybe ahead given the experience. Our virology, the virology portion of both courses is taught by a virologist from New York Medical College. So it's both courses are pretty intense, and students rank them very highly in terms of how satisfied they are and how well prepared they feel that those courses have prepared them to go into their clinical training. In terms of biochemistry, I know that maybe some of you were out there rolling your eyes and saying, oh, not again. However, this is medical biochemistry. And by that I mean, you're going to be reviewing, those of you who have had biochemistry, much of it will be familiar, but the applications will be new. So you will be working on second order thinking, the application of these biochemical processes to the functioning of specific organ systems. You're going to be talking about absorption. You're going to be talking about digestion. Obviously, you're going to be talking about liver enzymes, but where do they all fit in? Where do they gel to the well-being of the whole human organism? And we'll get to abnormalities in just a second. I teach cell biology and histology, which really is microscopic anatomy. In histology, we look at tissues. In general anatomy, for instance, you would look at the lung. In microscopic anatomy, we dissect out the lung, take a tissue specimen, and look at the structure of the tissue and the cells making up that tissue. And it's pretty fascinating because as one looks at the cells making up a tissue, one can rapidly understand, almost at an intuitive level, wow, what if this goes wrong? Or what if that goes wrong? And again, this course is a prerequisite for pathology, which is microscopic anatomy on steroids, if you will, because now you're going to be looking at tissues in second year and making a diagnosis, okay, based on that. And similarly, tying in with biochemistry and cell biology, we are one of the, if not the only medical school that has a separate genetics course. And really, this genetics course is looking at the obviously heritable, inheritable abnormalities one would find, but linking them to the biochemistry and to the cell disorders that one will see later on in pathology, and introducing early in your medical career absolute symptoms, absolute names of diseases, where they come from, what the genetic defect is resulting in the biochemical defect, resulting in the tissue and or organ abnormality. So that's a very early introduction to clinical medicine and personalized medicine in your first year, in your first semester. And along with that, we teach physiology. And physiology is a specialty devoted to the function of organs, tissues, and cells. For instance, the eye will show you the cell. The bacteriologist will tell you how an organism gets into the cell and disrupts it. The biochemistry professor will be telling you what has to happen for that cell to function normally and be a good member of a tissue, and the tissue a good member of an organ. I tell you, what that tissue looks like. The physiologist is going to tell you what the normal functioning tissue and cell produces, functions, and what those functions may be on another organ. And if one takes away those functions, what the results are. So this is also a very clinically oriented course where the students will take away case studies and now bring them into their second semester, where you'll look at the whole body, dissect the entire body, just like the allopathic medical students do. And we'll now introduce the nervous system to you. So now you've got an overall view of an entire body, from the gross to the microscopic to the functioning to the cellular. And now we move into your second year. The second year is devoted to abnormalities. You're experts after 1 year in normal functioning. At the end of the second year, you have to be good in determining abnormal function, what it is that is wrong. So instead of neurosciences, you now be doing neurology. You will be learning a neurological exam, what the symptoms are of, for instance, stroke, what the symptoms are of spinal cord injury. And you will be now specializing after general anatomy into minute dissection of the lower anatomy. This is where your specialty starts. And you'll be doing the lower anatomy, you'll be doing pathology, the abnormal tissues, okay? You'll be doing dermatology, abnormal skin, okay? We start introducing you to something that we're finding more and more students are interested in, and that's clinical research. We will be training you. You're going to have a certificate you will be able to conduct your clinical research study and be able to obtain informed consent. Now, the big test, as Dr. Perez said, you will now have to pass part 1 of your boards, which goes into all these subjects. But now the fun begins. You put on your white coat in July of your 3rd year, and now you move into your clinical years. And you take all these clinical subjects, which we've moved this year to a block curriculum, which we think is going to be a marvelous addition to our curriculum, that you'll be taking surgery in an intensive manner with nothing else. Internal medicine, intensive manner, nothing else. Okay. So I think that is going to be a really fabulous addition to fabulous correction, I would say, to our curriculum, and will dovetail beautifully with our what we present with you in the first year. So you're going to be moving in there with pharmacology, pathology, neurology, dermatology, microscopic anatomy, general anatomy, pathophysiology, abnormal physiology, and you're going to be starting as becoming clinical experts. So as you go out into your 4th year and your clinical clerkships, you are going to be right there with allopathic medical students, and you're going to shine. So, and at the end of 4th year, you will take your clinical boards, your podiatric medical boards part 2, and you'll be taking part 3, but this is a little bit different. You'll have to take that if you need a certificate to practice it, which is sort of an interim license. And the way the law reads is you have to have a DPM degree to sit for that. So more than half of our students sit for that exam almost immediately post-graduation, and we usually have 100% pass rate in that exam. We also have very high pass rates in our other board exams, higher than I'm not going to knock our sister schools, but we do better. And in terms of our clinical rotations, our students certainly stand out nationally and in some cases internationally. So
thank you, Dr. Shusett. Actually, just so our audience gets a better understanding of what the rotations in their 3rd and 4th year is like, Dr. Perez, if you don't mind jumping in, it hasn't been that long ago. If you can please, yeah, if you can please elaborate on the rotations in the third year, what it encompasses, and also talk some about externships and the other external rotations that our students do their fourth year in internal medicine, general surgery, and such.
Sure. So your third year, the beauty about NYCPM is that you have a clinic right on the first floor, right? So the clinicians are there, you have patients coming through. So your third year, you go straight there, and that's where you do your rotations. And maybe Ronald, since you're going through it right now, I'm assuming you can also jump in. But this is where you get a little bit more of patient care. So everything Dr. Chusett was just speaking about, you're in a classroom, and she was reminding me, you know, of like infectious diseases, you know, all the classes that kind of made me like, but you know, you study, you get through them, you do well, and then you get to put it all into action. And that's with your rotation. So you see the list there, you do, you know, your general pediatric medicine, pediatric surgery, obviously was one of my favorite ones. You have some great surgeons at the school. Radiology, you learn everything about x-rays, MRI, CT scans, when to order, how to take them, because you have an x-ray lab down there. So when the patient comes in, you are the one that's actually taking the x-rays, and you learn how to do all of that. Wound care, personally not my favorite, but it's definitely there. You see, you know, the school is on 125th Street, so you're right there. You're going to see a lot of wounds. You're going to see, unfortunately, you know, because there's no blood going to it, right? So you get all these crazy wounds. There's also some great clinicians in regard when it comes to podiatrics, and that's where I learned all the bracing and how to deal with the kids and helping them walk. And when you have a child that is limping or because of some deformity, and you can help them, right? It's really rewarding. Sports math was another one of my favorites, but basically your third year, you're into blocks. You do 3 months of certain rotations, and then you go to your next rotation. And I think Ronald can probably speak a little bit better of that, but I could tell you about fourth years, which was my personal favorite, because now you're done. Now you get to go out and experience an externship, which are 1 month long. And I went to San Diego, I went to Denver, I went to Seattle, I went to Boston, and I basically lived there for a month. It can get a little expensive, but you know, this is what you're going to do, right? So you're investing in yourself. This is going to be your profession. This is what you are going to do. So I wanted to go out and learn everything that I could. New York is wonderful, but podiatry does change depending on where in the country you are. So I wanted to go out west just to compare to what was being done in the east side. So they're a month long, and you are just part of the team, right? So residency programs, this is where you get to decide which residency program you want to go to, or you might learn that you don't want to go to that residency program, right? Because you didn't enjoy a certain aspect. Maybe you want to do more wound care, and you picked an externship that doesn't really see wounds, so you're not a good match. And you have to be a good match from both aspects, right? So they have to be like, okay, he or she is a good candidate, and the same thing for you. Okay, this is a place where I could see myself for the next 3 years, because that's where you're going to be, right? So you have to both kind of like each other, and it works out. But for me, fourth year I learned so much that fourth year, just going everywhere, traveling, and learning from different attendings in different parts of the country. But that's when you take your part 2, and then you are set. Although now you can take part 3. I'm not sure. I don't recall when you take part 3. I'm sorry. I'll let you guys say that, because it was a little bit ago.
So part 3 is actually, it can be taken while you're in residency, or it can be taken your fourth year. So actually, I would say about 80% of our graduating class took part 3, and we actually had 100% pass rate this time. So our students do really well on the licensure exams, part 1, part 2, and part 3, but especially part 2 and part 3, we've always been way above the national average, and usually resulting in 100% pass rate. So shall we go to the next slide? Dr. Chusett, this is you.
This is me. Okay. So about 13 years ago now, Dean Lee, Dean Treppel, and I entered into an understanding with the Icahn School of Medicine at Mount Sinai. Mount Sinai is about a mile down Fifth Avenue from the New York College of Podiatric Medicine. And they offer an MPH, Master of Public Health degree, in multiple tracks. And the classes start at 4 p.m. And the reason for that is this MPH degree is designed specifically for medical personnel, medical students, residents, practicing physicians. And the thought is that for medical students specifically, classes and labs are usually over by 4 p.m. Clinics in hospitals are usually over by 4 p.m. So that's the reason for the scheduling. The classes, you'll be taking all your regular medical school curriculum at New York College of Podiatric Medicine. And if you choose to participate, you leave NYCPM at about 3:30, and on a nice day, you can walk, or you jump on the subway, or right outside NYCPM with an ID from Mount Sinai, you can jump on a shuttle bus and be down at Mount Sinai in 10 to 15 minutes. As an MPH student, in addition to all the privileges that you have at NYCPM in terms of library, gym, etc., you are also considered a full Mount Sinai student with access to the library, the gym, and any other perks that go along with being a student at Mount Sinai. Up until now, what's very interesting that I find is that most of our students finish in 2 to 2.5 years. But that's not necessary. The MPH degree, I believe, is 30 plus credits, but Mount Sinai is on trimesters. So those credits mount up very, very quickly. And the students who have gone through it are great mentors to the students entering who want to pursue the MPH degree. They tell you, well, the courses in the MPH that are difficult, for instance, the biostats, well, don't take that in 4th semester when you're taking pathophys. Take it in 3rd semester when you have time. So those are the kinds of things that the other students share. But both degrees are finished in 4, or for the entering January class, 4.5 years. You're expected to do a practicum. Most of our students do their practicum on a podiatric related topic so that they can use our clinic right there at NYCPM, and certainly the patient medical records at NYCPM. And then just for those of you who like lists, the 7 concentrations or tracks that Mount Sinai currently offers for the MPH: epidemiology, which is a lot of biostatistics, but for those math geniuses among you, healthcare management. Our students have found that very, very helpful because they have found that when they finish their residencies with that MPH in healthcare management, which they're really quasi-experts on government management and policies, gives them a seat at the table in the management of the institution where they're going to be appointed. Environmental health is very interesting. Global also is extremely interesting. There is, in global health, there's a lot of emphasis on infectious diseases and epidemiology. Health promotion and disease prevention is also a very popular track right now, with Mount Sinai and MPH and NYCPM are very committed to diversity in medicine, and this is a very an excellent one. Biostats, for most of these tracks, you'll only have to take one course in biostats. I don't know that any of our MPH students have done a straight biostats track. And outcomes and research. Actually, I think one of our students has, I may be wrong on this, but one of our current adjunct professors, Dr. Hai Kim, a graduate of NYCPM, and works as a DPM, was in the MPH program, and I don't know if she's getting another master's now, but she teaches our students research methodology. So with an MPH, you could come back and teach research methodology at NYCPM. Or I think she might be getting actually a straight master's in research, but I look forward to incorporating some of our MPH students into our curriculum as guest lecturers, at least those that are around New York, because we try to take research very seriously, and to the extent possible, make research available to our students.
Thank you, Dr. Chusett. Actually, I think Dr. Hai Kim, she's doing her PhD at UPenn for research.
Yeah,
right?
yeah, right.
So next up, Ronald. Thank you, Ronald, again for joining us tonight. We have the slide prepared for you. We're hoping that maybe you can tell us about how you ended up in New York, how you chose NYCPM coming from Virginia. Tell us about student life at NYCPM and some of the clubs service that you're involved in.
Sure, yes. So like Dean Lee said, my name is Ronald. I'm originally from Virginia, but before that, I was born and raised in Puerto Rico. So Spanish is my first language, and that's actually a big reason why I chose NYCPM, because of the prominent Hispanic population. NYCPM is located in Harlem, New York, for anyone who doesn't know. And so it's a prominent Puerto Rican population on 116th Street. So I like to go there to get food sometimes. And so I came here, really, one of the first things I saw was the exemplary academic record. I'm definitely very academically minded as a person. And so that was a really big deal to me. When I visited a couple schools, and one of the big things, like Dr. Trusa mentioned, was that we have a genetics course, and genetics is on the boards. And some other schools didn't have genetic courses. And when I asked them about how they prepare for that, they're like, "Oh, we'll give you a book." And I was like, I don't know about that. So we definitely prepare you very, very well for boards. I'm studying for boards currently now, and I've just been using basically my resources from class and Sketchy. Regardless of what medical school you go to, I highly recommend Sketchy. But yeah, and so like I mentioned before, I've had kind of some foot conditions like flat foot in my life and in my family. Everybody has something going on with their feet. So I've been to a bunch of podiatrists throughout my life, and translated for my parents at the podiatrist. And really what it brought me towards the field was when I shouted a podiatrist, in one room, you're an orthopedic, right? You're looking at bones, muscles, you're talking about osteotomies, cutting bones and stuff. And then in the next room, you're a neurologist. You're doing neurological exams, testing to see how the nerves are doing, and do they have neuropathy, do they not, especially in diabetic patients. And then speaking about diabetic patients, you also kind of play a little bit of like an endocrinologist role as well, in a sense, and having to have knowledge about what's going on systematically to be able to treat the local problem in the foot. And as well as being kind of like a vascular doctor as well, because you have to have ideas of, PAD and peripheral arterial disease. And if you're going to be doing surgery on someone, you have to know, are they not going to heal well? Is it really the best idea to operate on this patient who might have impaired wound healing? Or, is it kind of like risks outweigh the reward, or other way around? So really what brought me to podiatry was, in every room, it's a different patient, and you can be doing two completely different things, So that was really exciting for me, coming into a field with so much so specialized, yet you have to be an expert in so many things at the same time. It's really an awesome dichotomy and a great challenge, you know, that you have to strive to be the best in every category, provide the best care for your patients, or at least that's, you know, that's what I strive to do when I'm in class. And so, yeah, that's kind of my journey. And like I said, I found out about NYCPM specifically through an Instagram ad. And then I started doing some research and I was like, oh, like podiatry is a separate school, you know, type of school outside of MD and DO. And then I started calling the schools and doing my research and really found out this is for me, you know, even though I'm pretty young, it's still awesome to have a quick track to be able to start to practice and you know, live your life and stuff. But yeah, in terms of what I do at NYCPM, I am a delegate to the American Podiatric Medical Student Association for NYCPM, one of the delegates. And basically, I don't know if any of you have heard of, you know, the MD version, AMSA, American Medical Student Association. It's essentially the same thing, but for podiatric medical students. And really, it's a delegation. Each school sends about, you know, 1 to 2 delegates per year, and plus the school government presidents to meet together twice a year and to basically talk about any issues and communicate on a national scale about current topics in podiatry. And it's a great way to really get to know other students. And like Dr. President mentioned, you know, podiatry is a national field, but there are local differences. So it's really nice to be able to communicate with schools from the West Coast and to see how they learn or what they're doing, and maybe, you know, bring some of those ideas back into what we're doing here. And in addition to that, you know, the students can also join in APMSA as well, even if you're not a delegate. For example, I'm on the social media committee. So, you know, I help make the posts for the Instagrams and stuff. So if you guys want to follow the American Podiatric Medical Association on Instagram, that'd be great. And if you like it, I'm an integral part. And if you don't, I'm just tangentially involved in making the posts. But it's great. You know, we interview students, and a lot of the students who make posts are students from schools. They're not delegates. They're, you know, podiatric medical students who volunteer. And I think that's something that's wonderful about the field, right? There's a lot of opportunities for leadership and for growth, right? Podiatry is not an especially large field. It's a specialty, right? You come into a specialty. It's like essentially if cardiologists out of school. You know, there's not that many cardiologists compared to all the MDs and DOs that are out there. So it's really great in that, you know, I'm for example, I'm a delegate for that. I'm also a student ambassador on here, you see on the slide, which is pretty much the students that when you come to visit the school, we do your tours, we interview you. Basically kind of you're a little bit of like a handyman or woman for the school, kind of admissions office, and educate prospective students, like, you know, doing this webinar about podiatry and why I'm here. And so you can do that as well as in the student council. We have a student government. Kind of like the best way to think about it is we have kind of both a federal and state level in terms of the student like government in terms of the school. We have a school president, a school vice president, and we also have class governments. We also have a class president and vice president cabinet, you know, because there are class, you know, things that come up, you know, like exams needing to be changed or class activities. And also there's school-wide, you know, things that need to be done. For example, like the welcome cruise, which is on the slide there, which is one of the best days that you'll have. It's when you first get here. Your whole class gathers on basically this like mini cruise ship that you go throughout the New York harbor, I believe. And it's a lot of fun. You meet all your, you know, before school starts, you meet everybody in your class. You meet some of the professors, some of the student ambassadors. That's another advantage. If you're a student ambassador, you can go more than once. I went last year, and I'm crossing my fingers I'll go again this year, Deanly. But so it's a great time to get to know your classmates before you start. And then also, and that's something that's pretty unique to NYCPM as well. And after that, you have your white coat ceremony, which is also it's a pretty, you know, surreal experience. You know, all of us worked very hard, you know, to get to the point where we are now, to either be applying or applied or accepted or enrolled into any form of medical education. It's not an easy field to get into. It's not an easy field to stay in. It's very, self-sacrificial, and it's just a day where you're celebrated, for your accomplishment, and it feels great. And yeah, it's a special moment, for with your classmates. And then football is also a celebration where it's basically like an NYCPM prom, sort of. And you see everybody like on their, Sunday best, I guess. And it's basically a celebration. Yeah, it's like a prom, and it's in the spring. And it's also nice because it's at the end of the first year, right? So you have like the welcome cruise when you didn't really know anybody, and then you have football when you do know most people. And it's also a fun time outside of class to get to know your classmates, and also professors also go. Graduation is something I have yet to experience, but hopefully will in a couple of years. But from what I hear, it's also a great experience. And going back to the student clubs, we also have, like you see on the picture there, basketball. We have a sports medicine club. There's lots of students who are interested in sports medicine, and who are athletes. There's actually a couple of people who did ballet in my class at a pretty high level, who are here. And as pretty much every sport as well is represented at some level. And their sports medicine club is cool because they actually I think it was them were kind of responsible for getting the gym in the school. So if you come to NYCPM, if you're feeling stressed or whatever, you can go in the basement and we have a gym that you can use. And then we also have a medical Spanish club, which I'm a part of as well. Like I said, we're in Harlem, so there's a lot of Spanish speaking students. So it's kind of an integral part of practicing in this area. And there's a lot of Hispanics also in the nation as well. We also have a research club. We have kind of two research clubs. So one's like a research club where you meet and there's opportunities for research. We have a professor here who's very, very, very connected, and Dr. Basu, and she helps students cultivate their ideas and get published. And then we also have an ACFAS club, which is the American College of Foot and Ankle Surgeons, where they also do research and go, and there's basically like a big conference that people go to, both podiatrists and students alike, and present their research and also learn about other research. And so there's a club for that here. We also have an Asian American podiatric medical student club as well. And we also have a podiatrics club. So that we have clubs for a lot of different things, and whatever you're interested in. Even those academics is very much a big part of our lives here. There's also opportunities for other things. For example, we played Temple in basketball, and we beat them. So if that's something that will determine where you go, we were superior athletically, in that sense at least. And so we do stuff like that. And then also, for example, we also had conferences. We had we went to a diabetic wound care conference in Washington, D.C., so kind of near where I'm from, which is really nice. And the school provided like 20 tickets for students to go. And then once we found out how to get there, we went, and it was a great time to get to know some residency directors and other podiatrists who are currently practicing. And it's really nice when you're a student to see what current treatments are, and just kind of get a glimpse of the real world a little bit. So that's a lot of information. That's kind of what I do sort of on a daily / throughout my NYCPM career.
Thank you, Ronald. You touched on a lot of things. So I can say fairly that as a student of NYCPM, you do have a lot of networking opportunities, whether it's by attending different conferences, or also we have a very active alumni that come back and speak to our students. There's a huge conference that takes place in New York City, sponsored by the New York State Podiatric Medical Association, and they always welcome our students to attend for free. And we have events that allow our students to network with alumni, many who are also residency directors or involved or attendings at residency programs. So that's another advantage of being a student at NYCPM. Ronald also mentioned that we are located on 124th Street, between Park and Madison Avenue, which is in Harlem. But I think as a New York City school, basically New York City is the campus for our students. We are an urban school. We are comprised of basically 2 buildings, but we really do try to incorporate New York City as a whole into our student lives. So from year 1, from orientation, we kick off the new class with the welcome cruise, which is not sure what the New York Harbor is, Ronald, but I think we basically take
Yeah, I'm from Virginia. Yeah.
Okay, we basically take a cruise along the west side of the city, going from Midtown all the way to Statue of Liberty, which is also one of my favorite events. And then it's a luncheon cruise where incoming students have an opportunity to meet with upperclassmen or student ambassadors, as well as faculty. Our white coat ceremony takes place at the New York Academy of Medicine, which is right across from Central Park. It's like a sacred organization for those involved, especially in research and medicine. Football, we choose a different location every year, but we always hit all the hot spots. You know, we've gone to those that are familiar with New York. We've gone to Chelsea Piers. We've gone to this most recent one, as was at Tribeca Rooftop, which is like where a lot of famous people get married and they hold a lot of like movie type events. And our graduation, we just had it this past May, always takes place traditionally at Lincoln Center, another beautiful event where we try to really incorporate the feel, the pulse of New York City to our student lives. I'm going to ask some questions to our panelists, but I'd really like to see if any of our attendees have questions. So like I said, you can put those questions into Q&A or chat, and what we'll do is we'll read those questions out loud for you.
Could I add something to what you said, Dean Lee, real quick? Speaking about being integrated in New York, and as well as the clinical education that Dr. Perez and Dr. Chusa were speaking about earlier, in addition to being in the clinic in your 3rd year in the 1st floor, you also get to rotate in the hospitals throughout New York. I'm at the Metropolitan, which is like on 86th Street or something like that, like 96th Street. So it's like in Midtown, and then Harlem and Lincoln. So you're also in other hospitals. So even as a student, academically as well, you're in other places in New York.
Actually, Rana, I also realized you can give an interesting perspective, because right now you're in the transition from the classrooms, transitioning to being in the clinic working with patients. Can you tell us about that experience and how well you feel prepared?
It's been awesome. It's been really cool because you get into classroom, and you kind of get lasered into that, and sometimes you forget that you're going to be a doctor, right? Not just someone who sits there and takes exams. And it's really cool. We had a patient last week who I was in the wound care clinic, and so they had an ulcer, and it smelled kind of fruity, and it had a green kind of essence to it, and ended up being Pseudomonas. And in our infectious disease class, we learned about Pseudomonas and everything that there is to know about it, and treatment, that you could use some sort of fluoroquinolone maybe, or something else depending on the patient. And it was really cool because you'll get asked questions in clinic, and there's no pressure to answer them correctly, but they ask you questions, and it's really a great feeling to take something that you learn in class, and then you see it in the patient, right? And like, oh, the Pseudomonas, and it's fused sketchy, it's Pseudomona, Mona Lisa, and she's in a hot tub, and so you remember these things in weird ways. And so it's a really cool transition, and to go from the classroom, and you'll have professors who come in and be like, plantar fasciitis, the patient comes in and say, oh, first thing in the morning I have pain, when I wake up, and then you touch the heel. This is called the medial tubercle, which is the bottom of the heel. You kind of like touch over here on the medial side, and they'll jump, and it's painful. And you're sitting in class, you're like, okay. And then literally, like, this patient came in this morning and was, I have pain when I first wake up in the morning, and then I start walking, and it kind of goes on, like literally like copy pasted exactly what the professor said. So it's really cool to kind of see those things and probably like, oh, this is actually real. So
Awesome, thank you. So we have a question. Can we further describe the broad opportunities and mission trips? So we do actually have what is IPC, International Podiatry Club, which is our student-run club that goes on annual mission trips. It initially started back, gosh, I think maybe even before Dr. Perez, maybe about 15 years ago. And our students always travel to Mexico. Since then, they've furthered their portfolio and have gone to Puerto Rico. They've gone to the Dominican Republic. They've traveled to different locations, but it takes place annually. Usually, I would say it's the second, third year students that are able to participate. It's very hard to participate as a first year. Because to be honest, you are focusing more on your academics. That said, your fourth year, there are many more opportunities to go abroad. Being located in New York and being the first college of podiatric medicine, we usually have a lot of programs from other countries come visit us, which opens up more opportunities for our students. So we do have an exchange program with Poland, Ireland. Our students have traveled to Israel, where they've done one of their clerkships in their senior year, working at a military hospital. And that was really great exposure. You know, though we are merging with Truro University, which is a larger university, we are still location-wise a dedicated school to podiatric medical students. And with it comes, you know, many possible opportunities that are student-driven. So if a student has an idea, so not too long ago, one of our students had a relationship with a hospital in Korea, and he wanted to do his clerkship in Korea. And it allowed us to forge that connection and offer that opportunity to our students. The New York College of Podiatric Medicine also helped to establish a podiatric medical school in Quebec, a sister school. And we have students that rotate through our clinic and hospitals from that program. It was dormant for a while because of COVID, but that will be picking up again, and allows for that collaboration and our students to learn about medicine outside of the US as well. So there are many international opportunities, exposure, and such. Dr. Perez, if I can ask, and maybe this will, if no one has any other questions, maybe this will help us to wrap up today. But, you know, we know the profession is great, the college is great, but I know, you know, nothing is perfect. So if you can share with what you think are some of the pros and cons for the profession for a student that's considering this pathway.
Sure. If I can comment though on the IPC, the International Podiatric, I actually went to Mexico for a week during my second year, and it was a great experience. You got to work with, you know, your colleagues, but as well as you were able to treat patients that don't really get this type of, there's no real podiatry in Mexico. So it was very, very helpful. I'm from Peru, so I do speak Spanish. I'm bilingual, fluent in Spanish. But in regards to the profession, like Lisa said, no profession is perfect. But as a board member, as I mentioned before, for the New York State Podiatric Medical Association, I'm trying to make the profession better, at least in the state of New York. We have a scope of practice in New York, and we weren't able to do the ankle a couple of years back, but now we can. And I want to keep going that forward, because it's kind of like a little, you have to get certified. You can't get certified if you don't have the case. It's like a chicken and egg type of thing. So that is something that is getting fixed, hopefully this year. So there will be no problems for anyone graduating residency. You will be able to perform surgery in the foot and in the ankle. In other ways that, yeah, podiatry is still, unfortunately, by some, not all professions, they don't see us as equals, right? A lot of people think ortho, I'm going to go to an ortho foot and ankle, which is fine, and you know that you can absolutely do that. But remember that if you choose podiatry, like I did, you do 4 years of med school and you do 3 years of residency. Yes, you see the whole body, but you are specialized from day one to the foot and the ankle, right? When it comes to orthopods and they do their residency program, which is 5 years of the whole body, they really don't see the foot. They can do trauma on the ankle, right? But you do a 1 year fellowship in foot and ankle. So it's, you know, personally, It's like, okay, I did 3 years residency and 1 year fellowship on the foot and the ankle. You can't really compare that to just 1 year of foot and ankle after you've done your 5-year residency. So from my perspective, when it comes to the foot and the ankle, we podiatrists are in charge of it, and we can take care of any aspect of that. But that would be like one of the challenges that the profession has, but it's definitely getting a lot better. And at the end of it, when you have a patient in front of you, they don't really care. They don't even MD, DPM, PA, they just want to get better, right? So if you can help them and you are a good doctor, you're going to be fine. So again, I'm very content with the education that I got at NYCPM. It's great, 4 years. I have friends for life there. Like, I talk to them almost every day. And residency and fellowship. And again, I've been in practice for 10 years, but whatever profession that you decide to go into, definitely research it, because it's expensive, right? You are going to spend a significant amount of money, but remember that you are investing in yourself. So how much are you worth, right? To me, I traveled, I went on externships all over the country. Yeah, it costs money, but I'm pretty successful right now, and I'm very happy with my choice.
Thank you, Dr. Perez. You're very successful, and I can vouch for that. That said, I see we have another question, and I know, do you have to shadow a podiatrist in order to apply? I know that many of our audience today, this might be your initial introduction to podiatric medicine. We don't require applicants to shadow, but once again, as Dr. Perez mentioned, you want to do your due diligence. If not shadow, at least speak to a podiatrist, a DPM, and we will be more than happy to match you up with a DPM. We've had more alumni offer their time to meet students via Zoom, and those that are interested in surgery also to share with you some of their surgical cases. So if you are interested in learning more, feel free to reach out to us, and we will help match you up with a DPM, hopefully in your area, that you can contact. And also mentoring, I think, is really key. Mentoring for the profession with a practicing podiatric physician, but also we have a lot of students at our school that are really helpful, and they love to mentor the next generation of students coming in. We also have a big brother, big sister program for incoming freshmen. So if you're interested in connecting with a current student, feel free to reach out to us. Also, I know that if you're active on Instagram, many of our students are on Instagram, and I notice they tell me that they get students reach out to them with questions all the time. So if you see someone from NYCPM, feel free to reach out to them, ask them any questions you might have.
I'm actually pretty active on Instagram, so if you want to follow Flex for an Ankle, you can see a whole bunch of stuff there. And I do mentor, and I do have people come through my office as well, so you're more than welcome to do that.
Awesome. Thank you, Dr. Perez. Thank you, everyone, for joining tonight. Thank you, Dr. Chusit and Ronald, our panelists. And I did not get to introduce our admission staff, Agatha and Samantha. So if you reach out to us, they're the ones that will probably be answering your calls and your emails and such. But we are actually, like I said, a small community. We are very much into helping future students. So if you have any questions, please reach out. Have a great evening, everyone. Thank you.
Bye.
Bye.